my name is Sharon and I'm from Brandman University. I'm a DMT graduate student with specialty in family practice. I'm here today to perform a comprehensive physical exam. So I have already washed my hands, provide privacy for the patient, and provide adequate lighting for the patient. So, but for the purpose of this video, I'm only gonna do one side part of the body, but in actuality, on the clinical side, I'm gonna do both sides. So I have a patient, her name is Orchid. She is 30 something years old. She is very alert and oriented with no apparent distress or discomfort. So her vital signs have been taken, they're within normal range. Her height and BMI, her height and weight is taken and it's appropriate for her BMI, as well as the Snellen chart, and her vision is 20/20 with corrective lenses. And so as I enter the room, I'm basically assessing her overall appearance. For me, she looks very healthy. She's dressed appropriately for the weather. I don't smell any foul odor. So hello, my name is Sharon. I'm your nurse practitioner that will be assisting you today. Can you please tell me your name?
Orchid.
Very good. Do you know what today's date, Orchid?
March 2019.
Very good. And what brought you here today?
I need to do a physical for my appointment.
Good. So I confirm with Orchid that she is here for her physical assessment. So as during my interview, I would also ask if she's currently in any pain or any discomfort. But in this situation, she doesn't have any. She's not currently allergic to any medication. She's not allergic to latex. However, she gets a seasonal allergy where she gets a runny nose, itchy eye, and sneezing. She's currently not taking any medication, prescription medication, but she's taking a over-the-counter multivitamins. And once in a while, she takes Claritin when she gets seasonal allergies. Past medical history, she was diagnosed with eczema when she was 2 years old, but she never had eczema since. Last time she'd seen a healthcare provider was last year, where she had her female wellness exam. She said that her pap smear was done and everything was normal. She said that her menses is regular and normal. She doesn't have any abnormal bleeding. For family history, I have asked her her health history of her parents, her grandparents, her sibling, as well as her grandparents. Sorry, I'm a little nervous. And so I asked her medical history. She does no allergy, and sorry, I forgot. She denies any use of alcohol. She does not smoke. She does not use any illicit drugs. She is married. She lives with her husband and 2 children, and she's actually working as a registered nurse and while attending a full-time school for her graduate degree for nurse practitioner. So for the review of system, Orchid denies any headache, any dizziness, any head trauma, no skin rash, skin lesion, no visual changes. However, she does wear corrective lenses, and the last time she's seen an optometrist was 6 months ago. And no hearing changes, no ear pain, no problem swallowing, no problem with her thyroid, no complaints of shortness of breath, no wheezing, no coughing, and no chest pain, and no palpitation. She denies any edema. She said her appetite's good, no no nausea, vomiting. Her bowel regimen is good, no urgency, no dysuria, no hematuria, no abnormal vaginal discharge, no muscle weakness or stiffness, and she doesn't have any history of seizure or no involuntary movements. So that is my H&P. So I'm gonna actually do my physical assessment. First is I'm gonna look at overall skin. I could see that she has a good skin turgor. There's no tinting. She doesn't look dehydrated. She is well pigmented. And while I'm here, I'm gonna also look at the capillary refills. It's less than 3 seconds. I don't see any clubbing or any cyanosis. So the shape of her fingers is it's good. The shape and contour is good. And also, go ahead, you put it down. I don't see any hyperpigmentation, particularly in the neck, where sometimes we could see some underlying issues of diabetes, but hers is evenly throughout. So, and I don't see any facial hair, any abnormal hair distribution. So that is my skin. So I'm gonna go ahead and go to her head and scalp. So basically, I'm looking for any lice, any bumps, lumps, or any lesion, or any abnormal hair distribution. So her head is normal cephalic and atraumatic. So that is my head. I'm gonna go ahead and look at her face. So basically, I'm looking here for symmetrical. I don't see any facial drooping or any deviation. Go ahead, can you pop up your cheek? Go ahead, relax. Can you smile for me? Very good. Can you close your eyes and let me open them? Perfect. Very good. Go ahead, open your eyes. While I'm here, I'm going to also palpate the cranial nerve number 5, is the TMJ. Go ahead, open your mouth. Close your mouth. Good. Do you feel any tenderness? Very good. So basically, I'm looking for any tenderness or popping. And that is my face. And now I'm going to go ahead and look at her eyes. So basically, I'm looking at her eyes. I'm looking for any exudate, any lesion, any redness. It looks pretty good. So do you mind if I'm gonna pull down your lid? So very good. Her conjunctiva is pink. Her sclera is white. I don't see any yellowish. So I'm gonna go ahead and proceed on my on my pen light. So I'm gonna do eye movement. So if you could just look here straight, and then after that I want you to look in the wall with just your eye, okay? And then look here and look at the wall. Very good. Go ahead, just relax. So her accommodation is perfect. And next one is I want you to look here and follow where it's going. And then follow, look at here, okay? Very good. So convergence is also normal, and that's cranial nerve 3, 4, and 6. So all fields is normal. I'm gonna go ahead and shine the light on her eye. So if you could just look straight for me. Very good. Look straight. Very good. So her pupil is equal, round, and reactive to light. So that's that. And then I'm gonna go ahead and use my ophthalmoscope to look for a red reflex. So if you just look straight for me. Very good. Oops, wrong. Very good. And I saw a red reflex, so that's perfect. So now I'm gonna go ahead and look at her ears. So that's my eye. So I'm gonna go ahead and look at the ear part. So basically, I'm looking for equalness, so they're both equal, and I'm basically checking for any redness or inflammation. So far it's looked good. So I'm gonna just palpate it, make sure there's no pain. Do you feel any pain? And while I'm here, I'm gonna palpate the mastoid. So do you feel any pain over here?
No.
No. Perfect. So in actuality, I'm gonna do also on the other side, but in this video, I'm not gonna do it. So next is I'm gonna check her inner canal. So basically, I'm checking for, let me know if I'm hurting you. So I could see, I don't see any redness or any erythema. I could see her tympanic membrane, and it's pearly gray, and it's reactive to light. Okay. And with that, let's do some hearing tests. So I'm gonna do the Ryan and Weber's test. So the Ryan test is what I'm gonna do. So I'm gonna put this behind your ear, and once you stop hearing the noise, let me know. Say stop, and then I'm gonna put it here, and then once you stop hearing the noise, just say stop. Okay?
Stop. Stop.
Good. So air conduction is longer than the bone conduction. So I'm gonna do the Weber test. Let me know where I'm gonna put this on your forehead. Let me know which side do you hear, or if you hear on the both side. Okay.
Both.
Very good. So Ryan and Weber says it's pretty good. So that is my ear. So now I'm gonna go ahead in the nose part. So first is I'm looking at the nose, so I don't see any redness, any itching, or any sneezing, or any runny nose, so it's perfect. And I'm gonna do some patency. If you could follow what I'm doing and inhale. Go ahead, and then do the other side. Do you feel any obstruction, anything like that? So her nose is patent. Now what I'm gonna do is I'm gonna look inside her nose. So if you could tilt your head backward, thank you. So it looks pretty good. Her nasal mucosa is pink. I don't see any bulging, any cysts or anything. So, and her turbinate I also saw, and I don't see any septum deviation. So that's nose, and I'm gonna palpate her sinuses. Let me know if you feel any pain. So this is front.
No pain.
No pain. Okay, perfect. So, so that's nose. I'm gonna go ahead, go down to the throat, the mouth and throat part. So, if you could just open your mouth and say ah. Very good. Go ahead, close it. I saw the uvula is midline. Her mucosa is pink. I don't see any ulceration. And I'm gonna go ahead check for cranial nerve number 12. And if you could stick out your tongue, go left and right, up and down. Very good. That's intact, and also. Cranial nerve number 12 is good. And for cranial nerve number 10, I'm going to gag the patient, but for this video, I'm not going to gag her. I'll just pretend that she has a positive gag reflex. Okay, so that's the, okay, sorry. So, and now we go to the neck. So basically, I'm looking for any bulging, any enlargement, or any lymphadenopathy. So, and yeah, she doesn't have any, so I'm gonna go ahead and start palpating for her lymph nodes. First, I'm gonna do the pre-auricular, post-auricular, occipital, post-cervical, pre-cervical, submandibular, submental, and then supraclavicular. Do you feel any tenderness at all?
No.
Okay, good. So she doesn't feel any tenderness. Basically, I'm looking for any enlarged lymph nodes. That could be indication of any inflammation, allergy, infection, or even neoplasm. So that's that. That's my neck. Now I'm gonna go ahead and palpate her thyroid. If you could just swallow for me. Very good. So I don't feel any bulging, so her thyroid is fine. So, while I'm in the neck, sorry, I'm thinking at the same time. While I'm in the neck, I'm gonna do some range of motion for her neck. So I don't see any swelling on her neck. Do you feel any tenderness in your neck?
No.
Good. So I'm gonna ask you to move from side to side for me. Very good. Go ahead, up and down. Up and down, perfect. Go ahead, resist against my hand. Very good. And then the other one. And then let's do the front. Very good. And do the back. Perfect. And then I want you to shrug your shoulder for me. Very good. Good. So she has good range of motion and muscle strength. So that's my my neck. And now, and yes. Okay. So now I'm gonna do the lungs part. So basically, first is I'm looking at her anterior and posterior diameter of her lungs. I don't see any barrel chest or excuse me, pigeon chest, and I don't see any accessory muscles. Her respiration is unlabored, so I'm going to go ahead and proceed to my auscultation part. For the clinical side, I'm going to ask the patient to take deep breaths while I'll put my stethoscope, but for this video, I'm just going to tell you where I'm going to put my stethoscope. First, I'm going to put it to her right upper lobe. Go ahead. You can just relax, it's fine. I'm going to put right upper lobe, and then I'm going to proceed to her left upper lobe, and I'm consistently listening for any crackles, rails, and then I'm going to go down, and then I'm going to go ahead to her right middle lobe, and proceed to right lower lobe, and proceed to her left lower lobe. So her lungs are clear, no adventitious sound. And yeah. And then I'm gonna have her turn on her back so I could listen to the other side also. So basically I'm gonna do the same thing. I'm gonna go as a sequence, listening to her lung sound. So I'm gonna go throughout to now I'm on the lower lobe, and then right lower lobe, and then left lower lobe. So basically no crackles, no rails, no rhonchi, and yeah, her lungs are clear. So next I'm gonna do is I'm gonna do a lung excursion. I'm gonna have you take a deep breath. Very good. Exhale. Very good. Lung excursions are equal and symmetrical. Next is diaphragm excursion, where I'm gonna ask orchid to inhale out and hold it. Go ahead, breathe in and hold it. Perfect. Oh, go ahead, just relax, breathe. So we have a 3 centimeter here, so that's perfectly fine. Anything between 3 to 5, it's perfectly fine. So next is the tactile parameters. So every time you feel my hand, I want to say 99.
99, 99, 99.
Perfect. So the tactile parameters is with good vibration. I don't feel any consolidation in her lungs. While I'm here, I'm going to perform some CVA tenderness. Let me know if you feel pain.
No pain.
Good. So it means she doesn't have any kidney stone. So go ahead, face the other side. And that's my respiratory assessment. I'm gonna go and proceed to the cardiac part. So the cardiac, basically, I'm gonna do first is check for pulses. Radial pulses, they're 2+, no, it's not weak and it's not super bounding. I forgot the medical term. It's not bounding. Sorry, it's 2+. And then I'm gonna go ahead and proceed to the pedal pulses. And it's 2+ also, and it's regular. I'm also looking for any pitting edema, which is a classic sign of some cardiac issue. For her, there's no issues. Yes, there's no pitting edema. So, and then I'm gonna go ahead, usually I'm gonna check for JBD. Usually I'm gonna have the patient lay down 45 degrees, turn on their side, and then I'm gonna assess for JBD. But for this, for this video, she doesn't have any, so. And also I'm gonna start auscultating for the, first is the carotid, and not palpate, but auscultate for the bruit. I don't hear any bruit, so that's good. And then I'm gonna go listen to the heart. First is I'm gonna do the aortic. Okay. I'm gonna do the aortic, which is in her right second intercostal space. That's aortic. And then I'm gonna go pulmonic, left second intercostal space. Erb's point, left third intercostal space. While I'm doing this, I'm consistently listening for S1 and S2. And then tricuspid is left fourth intercostal space, and mitral is left mid-clavicular intercostal space. While I'm here, I'm also gonna palpate for her PMI for the whole minute. hear only S1 and S2, so that's perfect. I'm gonna go ahead and turn my stethoscope on the belt side to listen for S3 and S4, and then I'm gonna go the same sequence: aortic, pulmonic, herbs, tricuspid, and mitral. So I don't hear any S1, I don't hear any S3 or S4, it means no gallops, no murmurs. So that's cardiac, and yeah, so that's cardiac. And yeah, so now I'm gonna go ahead proceed to the abdomen part. So if you could lay down for me. Okay. You comfortable? Yeah. Yeah. Okay. So first is I'm gonna observe. I'm looking for her any. Do you mind if I do this? Okay. So I'm looking for any any pulsation, any hernia, any scars, any actual bulging. But in this case, she doesn't have any. So I'm gonna go ahead and proceed to my auscultation to all 4 quadrants. So I'm gonna start first to right upper quadrant, proceed to left upper quadrant, and then go down, and then again to the last one. So she has a normal active bowel sound. It's not hypoactive or hyperactive. Next is I'm gonna proceed to light palpation. But let me cover this. So I'm gonna palpate. Let me know if you feel any tenderness or any pain throughout when I do light palpation, okay? Okay, so she did not complain of anything, and I don't feel any masses or any abdominal abnormalities. I'm gonna go ahead and proceed to deep palpation, and again I'm gonna tell the patient same thing. If in any kind, if she feels pain, to let me know, okay?
No pain.
Perfect. I don't feel any masses or any abnormalities in her abdomen part. I'm gonna try to palpate for her liver. So I don't feel any. And I'm also gonna palpate for her kidney. Okay, I'm not able to palpate her kidney. And before I forget, I need to listen to the bruits. Okay, so first I'm gonna listen to the aortic, both renals, iliac, and both femoral. So I don't hear any bruit, so that's perfect. And I'm gonna try to palpate her aorta also. Okay. And the next one I'm gonna do is a Murphy sign, where I'm gonna ask the patient to breathe out, and then I'm gonna put my hands on her right upper quadrant where the gallbladder is. So go ahead and breathe out, and then breathe in. Very good. Do you feel any pain?
No pain.
Good. So that's perfect, no pain. Next one is I'm gonna do obturator and psoas sign. Obturator and psoas sign. So sorry, I'm blanking right now. So go ahead, press against my hand. Do you feel any pain? No. Okay. How about actually, oh yeah, I'm gonna have you bend this, and then I'm gonna press it. Do you feel any pain?
No pain.
Good. Okay, so can I have you turn on your side, and then so basically I'm checking for any appendicitis. So lift this. Okay. Do you feel any pain?
No.
No. Okay. I'm gonna hyperextend her leg to check her mobility on her hip, and as well as the psoas sign. Do you feel any pain?
No.
No. Okay. Go ahead. So go ahead and go on your back. Next thing I'm gonna do is check for the varus and valgus sign. So lift your leg for me. So do you feel any pain?
No.
No. Do you feel any pain?
No.
Very good. So next one is I'm gonna do the anterior jaw exam, where I'm gonna put my um, I'm gonna sit on her foot, so I'm gonna tug this in towards me a little bit. Do you feel any pain?
No.
And I don't see any translocation of her ACL. So that's perfect. So while I'm here, let's do some knee knee range of motion. So go ahead, lift this up, press against my hand. Very good. And then opposite. Perfect. And then I want you to, you okay?
Sorry. Yeah.
I'm doing a range of motion on her hips. Go ahead, adduction and abduction and then adduction. Perfect. Any pain or tenderness. Perfect. She has a good hip and can you just go straight? There we go. And range of motion. So now I'm gonna go try to look at the joint, her ankle and her feet. Go ahead, move up and down, and then side to side. Do you feel any pain?
No.
And then try to separate your okay, perfect. Okay, go ahead, press against my hand and pull against my hand. Okay, very good. 5 out of 5. And with that, yes. So go ahead. I'm gonna have you sit down on this here. Sorry, I'm taking my next step. So, okay. So next thing I'm gonna do is let's do some tendon reflex. So first I'm gonna do the tricep. So relax for me. Perfect. And then I'm gonna do the bicep. Very good. And the brachioradialis. And then I'm gonna do the patellar. Very good. And then I'm gonna do the Achilles. And then while I'm here, I'm gonna do the Babinski test. Very good. And she didn't flare out, so that's perfect. And let's do the bony prominence. So you're gonna feel, yeah, bony. So let me know if you feel the vibration.
Yes. 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 Yeah.
Perfect. So that's that. So she it's very normal. And now let's do some cerebral sensation. Sorry. I'm thinking at the same time. So what I'm gonna do is I'm gonna do a sensation. So this is dull and this is sharp. Okay. So I'm gonna have you close your eyes and then let me know which one do you feel.
Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp.
Okay, good. Go ahead, open your eyes. Sensation is good. So now we're gonna do, I'm gonna have your index finger touch my index finger and then touch your nose as fast as you can. Very good. Perfect. And then we're gonna do some rapid hand movements where can you follow what I'm doing? Perfect. So it's very normal. And now what I'm gonna do is I'm gonna have your heel slide to your shin like this. And let's do the other one. Perfect. Okay, perfect. So now with that, I'm gonna do some. We're gonna do some range of athlete tests. So if you can follow what I'm doing, perfect. So basically, I'm checking her test, and then do the other side. Perfect. So her athlete test and her shoulder movement is very normal. And now we're gonna do pretend we're doing a emptying can. And then go ahead, put it down. Do you feel any pain at all?
No pain.
Good, perfect. And then she doesn't have any rotator cuff, so let's do maybe just one. So let's do you could do both. Sorry, and then do put it down slowly. Perfect. So she doesn't have any tear or any rotator cuff. Let's do a apprehension test. Pretend that you're swearing. And then I'm gonna put it down the middle. I'm gonna go ahead. Do you feel any pain?
No.
Good, perfect. And go ahead, put it down. And also I'm gonna check for let's check for her the tinel test. So let me know if you feel any pain on your finger. No. And then I'm gonna do the Fallon's test, checking for any carpal tunnel. I'm gonna do this for at least 1 minute when it's actually in the clinical. Do you feel any pain? No, perfect. So hers is negative, so that's fine. While I'm here, I'm gonna go ahead check for range of motion and strength for her upper extremity. And can you do straight and then press against my hand, press against my hand, and can you do this? Perfect. And can you do this? Then push against my hand, pull against my hand. Perfect. And then go ahead, relax this arm, and then I'm gonna try to oh, can you do this? So range of motion on the wrist, so it's perfect. Do you feel any pain?
No.
No. Okay, let's do some strength. Okay, go ahead. Press against my hand, then press against my hand, and then squeeze both my hands. Perfect. So as you can see, she has a great upper strength. And so yeah, I believe that's it. And so now I'm gonna have you do the stand up for me. And do have your like this, close your eyes. So as you can see, she's not getting dizzy. I'm basically checking for Romberg's test, and her steady is pretty good. So go ahead, open your eyes. Perfect. So now if you could walk for me normal on this area right here, and when you come back, walk with your toes. Walk. Then when you come back, walk with your heels. And then when you come back, walk, do a tandem walk where you could do, very good. Go ahead, stand straight. And then let's do a knee bend, shallow knee bend. Perfect. Any pain?
No.
Good. And then try to reach down for your feet. So basically she doesn't have any kyphosis or lordosis. And go ahead, stand up. And if you could bend all the way. Very good. So she has a good range of motion on her spine, and let's do from side to side. Very good. Any pain or tenderness?
No.
Good. As you can see, she has a very healthy individual with good muscle strength and range of motion. And that concludes my physical exam. Thank you so much. Thank you again.
Thank you.